can we do to help our body, our skin, navigate its way through menopause?
We are finite creatures. We're here for a certain amount of time. The skin and how we look sometimes is a reflection of our overall state of health.
I like to bring options to people that aren't walking away feeling like your face is frozen or you're so full of fillers. It's really about just having healthy skin and taking care of this organ. Before we continue, be sure to subscribe to the channel and hit the bell to get notified about our latest videos. What is going on with our skin up here and down there, not just as we age, but as we go through all the stages of menopause? My guest today, Dr. Amber Bocknek, a board-certified cosmetic medicine physician, has a diploma in cosmetic gynecology, and you specialize in women's wellness and supporting your patients through all stages, especially all stages of menopause. Hello, hi, welcome.
Hi, thanks for having me.
What's the number one thing that women need to know about their skin as they go through menopause?
It's changing 100%. The skin really starts to thin and dry out considerably, particularly within the first 5 years of menopause. There is an abrupt loss of collagen, on average about 30% within the first 5 years. So when some women have theirs, and again, this can even start at perimenopause. So menopause is kind of a definition where you go a year without a period. But that's not to say things haven't been changing for any particular woman 1 year, 3 year, 5 years, 10 years beforehand. So everybody is a little different, and you don't necessarily have to fit the definition to be having issues. But your skin thins, your collagen and elastin declines, you start to lose bone density and bone volume all over in your body. So it can be a whole litany of issues that can affect at menopause.
Do we lose bone density in our face?
You lose bone density in your whole body. So peak bone mass is earlier on in life, actually in the early 30s is where you hit sort of your maximums. There's multiple things that happen in your bony skull. Your orbit, the bony part, the opening for your eye gets larger. So this is one of the reasons why the eye starts to look more sunken. You lose the prominence in your cheek. Again, we lose the superficial, like the deep and superficial fat above it, but the bony structure is going. And so the skin isn't supported up here, and gravity always pulls down, so it drops. You're losing your jaw, your lower jaw, the projection over top of your teeth. So again, things are flattening, it's elongating, you're losing your jaw contour. So there are changes that are happening even at the bone level that affect the surface skin, because again, we lose the support, and then gravity, like everything, pulls everything down. And
should we be changing our skincare as we age? Should we start doing face yoga? Like what are some of the things that we do have control over without that medical intervention side quite yet?
Healthy lifestyle hydration can't be underestimated. There's some other factors there too. Exercise is really important because not only does it do good things for your heart, lungs, and vasodilate and get that going, but it opens up the blood vessels in the facial skin for better delivery of oxygen and nutrients. So exercise is really important. Meditation and yoga, I know you have a focus on mindfulness. It plays a role here in hormonal changes related to menopause, because one of the things that happens is women with stress and just life and some of the other things, our cortisol levels, one of our internal stress hormones, goes up. But with that can also some of the precursor to the masculinizing hormones, which again can further change some of these structures on our skin. So all of these lifestyle interventions are extremely important. Then if you want to take our first step into skincare, the first and most important thing beyond lifestyle is sunscreen, actually, at every age, starting younger and older. So this is something, again, that everybody should consider. It's not just for the sunny months, it's 365 days a year. The issue is the UV. UV comes through cloud, it comes through untreated windows. And so not only does it give you skin cancer, but it does things to your skin. So it, again, more rapidly destroys your collagen and your elastin fibers. It enhances laxity and some of those superficial skin changes. It causes pigment disturbances. So before you ever even consider doing anything for the skin as far as a treatment, the foundation on which all of this lays is prevention, which is sunscreen first and foremost. From there, you can look at collagen building agents. So topical vitamin C versus oral. Oral is very good for your immune system, but it's a water soluble vitamin. So in order to get higher concentrations that we want to actually help with collagen, because it's a building block for collagen,
Yeah.
topical vitamin C serum is really beneficial. There's lots of evidence to support the use of it.
Is there any products we want to stay away from or pay attention to with our skin changing?
In general, we need to be gentler with how we handle our skin. So the cleanser of choice, again, it doesn't have to be fancy or necessarily something bought in an aesthetic office. It just needs to be gentle and really kind of ideally free of dyes and perfumes or other irritants that can bother your skin. And you just don't want to over traumatize it too much.
Well, who would someone go see to is someone going to see someone like you or a dermatologist or like the local facial girl?
It's really about looking for someone who's done a lot of training and a lot of experience. So sometimes you can have some skincare experts who have done considerable amounts of ongoing education in spas, as well as cosmetic offices, medical spas, doctors' offices, dermatologists, and plastic surgeons. So there's a fair number of different places, again, depending on your geography, your location, your comfort level. Another part in all of it is you want to feel comfortable that you can communicate. There's a lot going on with the menopause, and you need to feel that you have somebody who has some empathy and will listen to you, as well as lots of experience and can guide you properly.
We talk about taking care of our other organs. We talk about heart health. We talk about bone density, and our skin is our largest organ being affected by menopause and aging. And yet this conversation may seem really superficial or out of vanity, when in reality, it's really about just having healthy skin and taking care of this organ at the end of the day.
Absolutely. And again,
Yeah.
too, it's about feeling good about yourself as well, too. I mean, let's face it, we are finite creatures. We're here for a certain amount of time, but you want to live your best life and feel comfortable in your own skin, literally and figuratively, at every age. It's like having a good hair day is sort of the best way I can describe it. And so for some people, they do just really good skincare. They wear their SPF, they exercise, they have healthy lifestyle, and they feel their best and they feel confident at every age. For other people, sometimes they still feel that that's not quite enough to get them where they want. And then we look at some of these other anti-aging procedures. But again, it's not one size fits all. So there's different levels that people can engage in this sort of activity to try to keep themselves the way they feel they match on the inside and the outside.
Let's talk about what can we do to help our body, our skin navigate its way through menopause.
The next direction that I see cosmetic medicine going, which is really so much more focused in what I call bioregenerative or biorestorative. It's way more on looking for treatments that help our body regenerate themselves, as opposed to a lot of foreign things. So we are using a lot more of treatments that stimulate, particularly a lot of these things work through wound healing pathways. So our body has its own way to fix ourselves if we get cut or burned. And so we are trying to direct that towards the skin overall health and appearance. And so we can do that mechanically using like microneedling. If you've heard of microneedling, it's a classic example of that. We use little tiny needles to mechanically make little mechanical perforations in the skin. It's like aerating the lawn. And then those little wounds stimulate the body the same way it would be stimulated by a cut or a burn to heal over. And so that helps you to gently make a little bit of new collagen. And you can bundle that up with things like platelet-rich plasma, where you draw the person's own blood, spin it down, take out the platelets. Platelets are usually things that we associate with making a little clot when you cut yourself, which is what they do. That's their first thing. But because they're like our own body's natural first responders when we get cut, they release all kinds of other cell signalers that bring in cells responsible for healing. And so sometimes we combine PRP, or the platelet-rich plasma, with these micro perforations we make, and we apply it into the skin to try to make the skin, again, to further boost wound healing. And sometimes we use injectables to do that as well, but in a non-traditional way you would think of a filler. So if people are familiar with fillers, fillers are like biocompatible gels that we use to add volume historically, something that we are moving a little bit away from. We still use it to add volume in depressed areas, but we're not using it for everything anymore, which I think is a very good move. There's a lot of overdone filler out there. But one of the fillers is a specialty filler, and it contains little tiny pearls of something called calcium hydroxyapatite. Big word, but what it is it's little calcium granules, the same nature as what is present when you break a bone. And so if anyone's ever broken a bone, I don't know if you've noticed, but sometimes you get shiny skin that's thickened a little bit over the fracture site. And that's because that calcium hydroxyapatite released from your bone stimulates you naturally to thicken up your skin. Lastly, for laxity, one of the things we have, again, outside of big procedures like a facelift, ultimately, those are that go and tighten tissue. We can use ultrasound. Again, this whole theory of making little wounds. Ultrasound, just like ultrasound, you go to get your appendix looked at or your gallbladder, goes deeper than the surface skin. So we can utilize ultrasound because it goes deep to target connective tissue, the thick connective tissue layer in the face underneath the skin and the subcutaneous fat is a connective tissue layer called the SMAS. That's the short form for it, the SMAS. And that's what a lot of times the surgeons are grabbing to pull. But we can, again, put little wounds in it with the ultrasound. If you focus the ultrasound like playing with a magnifying glass, you can actually make little heat wounds and stimulate a bunch of new collagen. So it's a way to tighten and lift deep underneath, again, to try to address the deeper layers. So all of these things are utilizing bioregenerative techniques. It's person making more of their own collagen. So it's natural and it's sustainable over time. And those folks don't look unnatural with it because it's, again, utilizing nature to do what nature does best.
Well, I love that, using your body's natural healing abilities and just kind of you giving it a leg up, a lift, a little bit. Just very similar to people when they talk about, well, if I can't lose my weight, I'm just going to go liposuction and whatever. So I like to, bring options to people that aren't walking away feeling like your face is frozen or you're so full of fillers. And I think for a lot of us, especially older women, that's our association to that.
Yeah, so there is now a very active movement in a number of my colleagues towards really looking towards these more natural bioregenerative methods and trying to help people who kind of got stuck in the trap of being overfilled and trying to bring them back to looking more like what nature gave them.
Let's talk about what's happening with our skin down there.
The down belows. So in that area, basically everything that is visible that you're seeing here is also happening where you can't see it. So again, in this area, there is a sort of menu that we can do from, again, least involved to more involved. The fundamentals still apply. So everything we spoke of with the skin as far as lifestyle, healthy lifestyle, very, very important. Speaking with your physician to see if you are open to, and if you are a candidate for hormone replacement, that can be exceptionally helpful down there. But not everybody is. So in the same way I said, be gentle with your face, you want to be gentle with those gentle parts. So again, the vagina keeps itself naturally pretty clean. So if you're showering, again, just shower water, avoid things like harsh soaps, douches, personal cleansers down there. It can really alter the pH and it can cause a great deal of irritation. The second thing is really look in your pharmacy in the women's health area for vaginal moisturizers.
Okay.
You get dryness in your internal vagina as well as your external, the same way the face gets dry. So there are moisturizers, different brands that you can pick up at the pharmacy, again, that are not scented. They are designed for that area. So don't use your face cream there. Use special products that were designed for that area down there. Again, for intimacy, water-based lubricants are your friend. So again, you at the pharmacy, there's a whole section there. Don't pick things that have scents, flavors, or are heat up. None of that kind of thing. Just regular, straight up water-based moisturizers. They are much lubricants. They won't irritate and they help tremendously. And then other just non-irritating things, like try to avoid pads and panty liners if you can. Good old-fashioned granny panties, they can be pretty, but cotton, mom knew best, those cotton undies that breathe. And again, try to have them off at night. Again, all of that helps to promote a healthy pH, a healthy environment, a non-irritative environment, which is, again, better overall for comfort.
An aha moment where you're saying what's happening with our face up here is what's happening with our skin down there. It's the same thing. I would imagine we get more sensitive as we get older. If the skin
Yeah,
becomes thinner, it can get more irritable. So if you're sensitive to stuff on your face, you wouldn't want to be putting perfumes
right.
and stuff down there either. What about estrogen cream down there?
Estrogen cream is very helpful down there. So there's lots and lots of evidence for that in that area. So
So one of the things I've heard that estrogen cream does is helps to thicken up the tissue.
it does. So it helps with all aspects down there. So it helps with maintaining the healthy pH. It helps with thickening things up. It helps with lubrication, the elasticity. All of that is a little bit better. Like,
Can we do lasers? Can we do, I don't know if you want to do microneedling, but
yeah.
shots, like,
So
okay.
actually, there's a fair bit of overlap. So if we use, it's kind of funny if you use the face as an example. That you can also apply a lot of those same principles. So what you do to your face, a lot of these things translate there. So yes, we do laser there. We do PRP or platelet-rich plasma or platelet-rich fibrin in that area. But those are different ways, again, non-hormonally or with hormones. It works beautifully together. I mean, together synergy is always better, but again, that's not always an option for everyone. So we have different ways to kind of customize it based on what's going on in that person's life and their.
What do we want to look for to make sure we're getting the right care
Yeah,
here?
it's you do have to be a little bit careful, particularly well, in every field actually. You have to be
Yes.
careful. So you really want to make sure that you have credentialed people. This is the biggest thing. So physicians, if they are licensed physicians in Canada, we are all listed, well, in Ontario on the College of Physicians and Surgeons of Ontario website. So
Great.
you can check anybody out anytime. Another thing to do is, again, you want to make sure that the equipment they use is certified, and you
Yes.
can check those things out in Canada, because there are a lot of knockoffs and counterfeits, and so you want to make sure you've got a bona fide place. So it doesn't mean that a small strip mall doesn't have somebody there. You just need to do your homework and just check a little bit.
So there is, making sure you're eating nutrient-rich foods, you're hydrated, you're exercising, you're managing your stress. I would imagine getting in some good sleep, maybe looking into working with your doctor on your hormone therapies, and talk to your health care professionals about that. There is then the side of, your skin care, making sure you're using sunscreen, the vitamin C's, the retinols. There's also the bioregenerative options as well. So let me summarize this up. There's a lot you can do to help, I don't know, combat the hormone changes through menopause, or is it just aging in general? But there's a lot we can do to be proactive about what's happening with our skin.
And our whole body, for that matter, right? It's all in one. The skin and how we look sometimes is a reflection of our overall state of health. We are not one thing or the other. We are completely interconnected, mind and body. And so this is where I think there is a huge crossover between what you're doing with healthy living, lifestyle, stress management, sleep, and everything we're doing here. Again, more from that bioregenerative point of view. They all go together. We are living organisms, and we are affected by all of our systems. So we have to look at ourselves in totality, for sure. Yeah.
Woo! Mad respect for this conversation. Mad respect for this conversation. Amber, thank you so much. My eyes are wide open from this conversation. I'm so glad that you came on. I'm so glad we had this conversation. Who knew? Honestly, who knew? Who knew? Thank you for enlightening us. Again, our conversations are always about bringing awareness. What is going on? What is normal? What isn't? What can we do? So thank you so much for joining me today.
Thanks for having me. It was super fun.